Hi everybody, I'm Eric Pullman, Doctor of Physical Therapy for Fit Physical Therapy, and I'm here to talk about Achilles tendinopathy today. I have my subject here. His name's Jay. He is an ultra-marathoner. He's actually in training for his third attempt, hopefully his second successful one, at the Leadville 100-mile race coming up here in about a month. So let's get to work on his heel. So Jason's had this problem area here along the what we call Achilles tendon. Been a little painful with his training regimen, which has been pretty intensive. So he came to me yesterday with a little irritation and pain in this area, and I'm going to run you guys through exactly the treatment that we did, which resulted in immediate, almost complete relief of his symptoms last night. He woke up this morning with no symptoms whatsoever, which was a complete change from what he's been experiencing. And he had a very slight return of his symptoms today with a stair climber exercise. But of course, remember, physical therapy is more of a process. It's not something that will immediately fix a problem. Okay? So what we started with was just a little instrument-assisted soft tissue massage, and we worked directly over this painful tendon. This is possibly going to be affecting his neurological system and kind of desensitizing the whole area. It also could be working on the collagen, the specific tissue in the area. And we know that with tendinopathies, this kind of tendon tissue gets a little disorganized sometimes, and we think that may correlate with the pain. And so there are some studies that show this can actually reorganize that tissue. So that's all we're doing with his tendon. It doesn't take very long. And then we actually will work further up the calf with a larger tool in a minute, just to kind of lead to a little bit more loosening of the tissue, hopefully. So in clinic, I would actually do this about 3 times as long, but for the sake of brevity here, we're going to treat further up the calf, right on that calf muscle as well. And of course, I would continue doing this just for a little bit longer till I kind of feel the tissue loosening up. Okay guys, we just finished with our soft tissue massage, and now we have cleaned his leg thoroughly, and I even like to use a little bit of alcohol to make sure all that lotion's off of there so we can apply our tape. All I have here is a little piece of Kinesio tape. You can use any kind of brand. I'm not partial to one or the other. What I like to do is always around the edges. That way it catches clothing a little less. For the heel, Achilles specific, I like to split it about halfway down so that when we apply it, it splits above the most painful spot and it goes up into the calf muscle here. Now the point of this tape isn't necessarily to make any tissue changes. It's just a little stretchy tape, guys. It can't really do that if you really think about mechanism of action. But what it can do is provide a couple extra signals up to the brain to make it stop and think, hey, is this really dangerous to us? And thus, should we really be producing pain because of this small change? And a lot of times we have some pretty good results. In fact, like I said before, Jason experienced complete relief of his symptoms last night when we applied these same techniques. So what I have him do is he has flexed his foot up as maximally as he can, and then I will just apply this tape down here right over the tendon, not with any extra stretch in it. I just lay it right down. Try to get it as flat as I can here so that any wrinkles won't be causing any kind of hot spots. And then these other 2 pieces up here, I lay them down as well. No extra stretch added. Somebody with a nice hairy leg, unlike Jason here, you may actually need to shave that leg first to really get this to stick if you think it's going to be effective. And there we go. Little Achilles tendon taping. Notice that when he relaxes that ankle, that the tape actually kind of wrinkles up a little. So that's a good thing, okay, as long as all the edges are down nice and still sticky. Okay guys, now on to the last and actually the most important part of our treatment for Jay. We have eccentric exercise. We just did a little bit of manual therapy, some hands-on, but I never ever perform manual therapy alone. And it's very important because the results of manual therapy, the effects of that are very temporary. So I never ever do anything like manipulating a patient's back or quote popping it. I never ever do just soft tissue massage without following it up with some kind of movement. And the literature actually shows that this eccentric exercise is the most important and the gold standard treatment for any tendinopathies. So if you are going to a practitioner who is just giving you manual therapy, you need to step back and question if that's really working for you. So right now, Jason's going to demonstrate what eccentric exercise is for the calf muscles. Basically, it's the muscles contracting while it's lengthening. So what he's going to do is actually lift both of his heels up, and he's going to lift his right leg completely off the ground and slowly lower that left heel back down. And he's going to do this 2 or 3 sets of 10 or 15 per day. Very important. Very good, Jason. As he gets better at this, we're going to actually really try to overload that tissue by adding even more weight. The great thing about eccentric exercise is that you can put more weight on this than you could trying to lift the heels up. He's just got to control it on the way back down. And that's one of the most powerful tools we have for a tendinopathy. And hopefully you'll be seeing Jason finishing up the Leadville 100 race here in another month. Thanks. Have a good day, guys.